It's Wendy Griffin, and today I'll be talking about measles morbillivirus or measles rubella. Measles virus is an acute fever illness and is responsible for over 100,000 deaths despite a vaccination available. The first documentation of measles was right around the 9th or 10th century and was by Persian philosopher and doctor Rhazes. There was further information provided in 1757 by Francis Home, who was a Scottish physician and was able to conclude that measles illness was caused by an infectious microbe in the blood. In 1912, the measles virus became nationally recognized in the United States, and U.S. doctors and scientists were required to report any diagnosed measles cases. An average of 6,000 deaths per year were recorded in the first 10 years of reporting in the U.S. alone. Before a vaccine became readily available, it is reported that almost all children became infected with measles by the time they were 15. An estimated 3 to 4 million people in the United States were infected each year. Measles virus occurs in humans only, and there is no known animal reservoir, which makes it difficult to study. The most at-risk demographics include children under 1 year old who are not immunized, children with underlying health concerns or poor diet, and pregnant women. And again, regardless of an effective vaccination, there are cases worldwide yearly. In India, in 2020, India took the lead with 1,620 cases, and Nigeria followed with 1,501. And despite the United States declaring elimination of the disease for over 20 years, in 2019 there were 1,282 cases, although that number dramatically decreased in 2020 with only 13 reported cases. Measles is extremely contagious. It's so contagious that if one person has it, up to 90% of the people that have come into close contact with that person and are not immune will also become infected. The transmission of measles occurs through any and all of the following: droplets from respiratory system, close contact, and through small aerosol particles. It is found that the measles virus can live up to 2 hours in an airspace after an infected person leaves any given area. Infection begins with the breach of the respiratory system by measles virus. The virus infects the respiratory tract's lymphocytes, dendritic cells, and alveolar macrophages. Soon it will spread to nearby lymphatic tissue and then disperse throughout the bloodstream, allowing the virus to spread to distant organs in the body. The initial inflammation of the respiratory system and organs leads to the exhibition of symptoms including red and watery eyes, coughing, runny nose, and high fever. The host's immunity is depressed by the suppression of interferon production by the virus. The viral replication begins and stimulates the humoral cellular immunological response. The initial humoral response consists of IgM antibody production and is detectable 3 to 4 days after the rash appears. IgG antibody production follows, and these antibodies are primarily against viral nucleoprotein. The measles virus causes depression of the cell-mediated immunity, but despite this fact, cytotoxic T cell responses are detected. The cell-mediated immunity response is slow and is slow and only detected at low levels. However, memory T cells are detected long after the measles infection. The measles virus is a negative-sense single-stranded RNA virus which belongs to the morbillivirus genus. It consists of a helical nucleocapsid. It is 100 to 300 nanometers in diameter and surrounded by an envelope. The envelope is lined by matrix proteins and carries transmembrane hemagglutinin and fusion glycoproteins. The measles virulence factor are fusion machinery that are made up of 2 viral surface proteins. These complexes are comprised of attachment and fusion glycoproteins. Scientists believe that upon interaction of the attachment protein, changes to the proteins are triggered. Ultimately, this leads to the injection of the ribonucleocapsid complex into the host cell. Research recently shows that the membrane fusion induced by the microbillivirus glycoproteins is the first critical step for viral entry and infection and is the determining factor in the cell's pathology and disease outcome. The measles virus mechanism is a bit unclear due to the lack of studies because of the lack of animal models, which is related to no animal reservoirs. But we do know that measles virus causes profound immunosuppression, resulting in high mortality rate. Knowing the signs and symptoms. The signs and symptoms are a very high fever with spikes up to about 104 degrees, a cough, runny nose, red and watery eyes, also known as conjunctivitis. 2 to 3 days after the first symptoms present, you'll see white spots in the mouth known as Koplik spots. And 3 to 5 days after first symptoms present, you'll have a body rash. This body rash will be low, flat, pink patches with little raised bubbles on top. This rash can actually grow together and cover the entire body. During this rash phase is typically when you'll see those high spikes over 104 degrees in your fever. For diagnosis, you're going to want to see your doctor. Your doctor will do a thorough examination, and based on one or more factors found, laboratory testing will need to be done for confirmation. A serum sample will be taken in order to detect the measles-specific IgM antibody in the serum, or a throat or nasopharyngeal swab will be taken in order to detect measles RNA by reverse transcript polymerase chain reaction testing. Molecular analysis can also be conducted to determine the genotype of the measles virus. Genotyping is the only way to distinguish between the wild type measles virus and a rash caused by a recent measles vaccination. Genotyping can also be used to track any outbreaks and find the imported cases. At this time, there is no antiviral treatment for measles. We can only provide symptom relief for fevers or headaches, and then care for complications such as bacterial infections. The most common bacterial infection would be a bacterial PNA. For severe cases, children will be hospitalized, and vitamin A will be administered, and it will be repeated the following day. This vitamin A infusion starts at about 50,000 IUs for infants younger than 6 months and goes all the way over 200,000 IUs for children over 12 months. There is hope on the horizon. There are current studies to develop anti-membrane fusion drugs, and based on our knowledge of drug-resistant mechanisms, we know that there will have to be a combined therapy in order to be effective against these viruses. We also, for prevention, isolation of an infected patient is key to help eliminate the spread. And then, of course, there's the vaccination. The MMR vaccination is the measles, mumps, and rubella. The measles component of the vaccine was licensed in 1968. 96% of children who develop antibodies after the first vaccine dose at 12 months, and anyone who doesn't respond to the first dose will respond to the second dose, and it has about a 99% efficacy rate. Recently published evidence shows that contracting the measles virus can have further long-term health impacts. The virus actually damages the immune system due to a profound immunosuppression, and damage can last for months or even years following the infection. This immune amnesia leaves survivors vulnerable to potentially deadly diseases like influenza or severe diarrhea by harming the body's immune defenses. It is important to educate and to prevent to the best of your individual ability. Thank you so much.